Right, we take you back to this conversation with Dr. Joseph Mwangi, Medical Officer and Advisor for Non-Communicable Diseases and Mental Health, World Health Organization, South Africa. Dr. Mwangi, let's pick up that conversation. And the last chat we had was to what extent, in fact, COVID-19 exacerbated issues related to loneliness?
Perfect, and apologies. Technology has a way of coming in the way of a beautiful conversation. COVID-19, brought out the real burden of isolation and loneliness because especially of the interventions like the lockdowns, where more people were more inclined to stay indoors, not necessarily because of the government intervention, but because of the fear of coming into contact with people. And over a long time, more people desired to stay indoors for fear of getting infected or infecting their loved ones. And even after the pandemic, a lot was seen that our desire or our ability to even form meaningful connections had been affected. Remember, making connections is a skill that you harness, and the more you are withdrawn, the worse your propensity or ability to form this network. So after the COVID-19 and during the COVID-19 is when this problem has been seen significantly. A lot of people, especially the older persons, showed significant levels of mental health effect of isolation during COVID and even after. So this has formed part of the justification for forming this commission to start looking at policies to address isolation and loneliness.
So let's break this down and look at how loneliness manifests across different age groups and regions. And are there notable disparities in its prevalence and impact?
Sure. Amongst the youth, then if I would draw you to a simple example of loneliness, is a young adult who joins college and doesn't seem to know anybody, and joins the cafeteria and has a feeling of loneliness. That's loneliness in its small form is a normal phenomenon, but when it is profound, it starts affecting learning, it starts affecting workplaces performance, it affects self-esteem, it affects forming networks and forming healthy relations. And in the older populations, as I said, people who have profound loneliness have been shown to have poor immunity, so they have frequent infections, they have high BPs or cardiovascular diseases, especially the coronary artery diseases or heart attacks. And then they also have a high risk, up to 30% of strokes. It's also been shown that there is a faster cognitive decline amongst the older persons and increase in the onset and the presentation of dementia. And also, remember, I had mentioned that amongst the older persons and generally amongst the adults, a lot of people who are lonely pick up maladaptive forms of adapting, like smoking heavily, alcohol, and sedentary lifestyles. So across the continuum, there is differences in how it presents.
Now, Doctor, there's a belief or a theory that when most individuals retire, and obviously you're retiring at 65, that, a few years after retirement, many of these individuals succumb to various health issues, and which leads to death. Is this the greatest indicator of the loneliness pandemic that you speak of, that many of these individuals that are retiring are obviously away from the hustle and bustle of the work life and the people around them, so obviously weren't lonely. And the minute that they step away from that, they don't have that support structure, and many become lonely.
Yes, it's one of the reasons and one of the explanations you give, because as we know, stimulations and stimuli from around us makes our brain grow and keep growing. And so when one retires, a significant amount of that stimulation that keeps your brain active for cognitive development and continuous learning is dealt a blow. And in countries that have policies that promote retirees to keep them active in different networks, in older persons' homes, and in community networks to keep them, giving and, participating in activities that keep them active, it's been shown that that cognitive decline is slowed down, and also the risk of death and that isolation is reduced. So actually one of the pillars of response to which WHO is hoping on is to have pro-connection government policies. Every government sector has a role to play to reducing isolation and loneliness, And so those policies range from when people are working to form functional networks that can keep them going even after retirement, and also engaging people in retirement to make sure that the networks don't significantly dip that would lead somebody into loneliness, and also get them these risks that we're talking about.
Now, what preventive measures are being considered, or rather, in fact, I suppose the final question before we go is, how does the WHO plan to raise public awareness about the significance of loneliness as a public health threat?
Okay, so the very first thing is what I've mentioned, that we are moving on high gear for awareness and advocacy, because when an issue is not talked about, when an issue is ignored, it takes a course of its own. So we are putting loneliness and isolation and lack of social networks right at the top of the policy agenda. This committee, if you may look at its composition, it is co-chaired by two very serious guys. One is the U.S. Surgeon General, Dr. Vivek Murthy, and also we have the youth ambassador of the African Union from Zim. So they are very serious fellas. There are 11 guys in there who will push governments towards seeing these as a significant problem, just like alcoholism and tobacco and lack of physical activity. And so the very first one is to create that movement of talking about loneliness. The second one is to, as I said, to push government towards pro-connection policies. Let me give an example. Social media and internet and connectivity is one of the things that have been blamed for causing isolation and loneliness, because it boxes us into a small little space where we don't feel the desire to put out and to make this connection. But that same social media and the web and the connectivity can be used as a tool to reduce loneliness. So we are trying to see how we can reform the digital environment to be pro-connectedness, and also issues around embracing those cultural institutions or practices that reduce loneliness in the past. One would wonder, why now? So there are things that we have let go that we used to have. In a community, the older persons belong to the community. We visited them, they were part of the community. But because of the hustle and bustle, as you call it, everybody is busy, kids have moved out, there's very little time to go see these people. They have been left alone. And also among us, the working people, initially, remember when we were defining loneliness, we said there is a possibility of being lonely in the midst of a crowd. So we want to make sure that we can be able to identify early enough, because people who are identified early enough have better outcomes in terms of treatment or help. And the final pillar, of course, is to increase the high index of suspicion among our healthcare workers. Sometimes people come with physical manifestations, they're having chest pain, back pain, but when you listen to them, you realize that this is a psychosomatic issue or a mental health issue, or it's loneliness manifesting in a physical form. So we have a high index of suspicion to ask more questions and to probe and to see how we can help some of these patients who come to us every day, but we miss it in broad daylight.
Now, so we leave that conversation. Dr. Joseph Mwangi, Medical Officer and Advisor for Non-Communicable Diseases and Mental Health at the WHO South Africa, as the WHO declares loneliness a global public health concern.